On to Kashmir now. After 11 days of no vaccines, Kashmir has finally received 90,000 vaccine doses. The consignment is meant for the month of May for 10 districts in the valley. The region is currently facing a severe vaccine shortage at a time when there is a spike in COVID cases and COVID deaths. Large number of cases are being reported from rural areas of Kashmir where the health sector is too fragile to deal with COVID. Health Department has now started mass COVID testing in several villages, reporting very high number of positive COVID cases. My colleague Nazir Masoodi joins us live. Nazir, much needed relief after all vaccination centres across Kashmir recorded 0 vaccinations on Sunday. Now, I understand that this new consignment of vaccines is for 10 districts in the valley, but how long do the medical officials expect these 90,000 doses to last? And also, what happens to the other districts? Do they have sufficient stock?
Well, it is too little and too late. 90,000 for 10 districts for 13 days. You do your math and it's like, each day they have to give like 6,900 for about 7,000 doses across 10 districts. What we are facing here is the lack of vaccine transparency in terms of releasing the data. For example, after releasing the data about 0 vaccination for almost 10 days in the valley, government stopped releasing data for last 2 days. There was some vaccine in Jammu, but that is too little. For example, in 10 districts there, in the province, on Sunday they had just 9,000, or Monday they had just 9,000 doses. But then they stopped releasing the data at all. So now the government has announced that they have received the fresh consignment of 90,000 doses, but that is for 13 days. The whole month of this May, they are not going to receive that any new consignment. So people have to just deal with this thing. There would be very slow process of vaccination, and the vaccination centers, their number would be reduced as well because there are no vaccine. And this at a time when the region is actually facing spike in COVID cases and deaths as well. For example, yesterday there were 71 deaths reported in Jammu and Kashmir. Day before yesterday it was 73, which was the single highest, fatality because of the COVID in Jammu and Kashmir. Most of the deaths have been reported in Jammu. For example, yesterday there were 32 deaths in the valley and 39 in Jammu. And what is worrying more is that it is spreading. Virus is spreading to the rural areas, and the health department has now started mass testing, in many rural villages as well, which have reported high number of cases.
Thank you so much, Nazir, for joining us with that crucial update.